and today is the third lecture of the lecture series of senior dental care. Now today's main topic is what are the most common oral lesions seen in elderly people. Now before we start talking about the common oral lesions seen in elderly, I would like to first discuss that the oral cavity is a window of the general health of the elder person. We have to remember that you cannot have good general health without good oral health. There are many systemic problems or malignancies in the body which affect the oral cavity, and similarly there are various pathologic conditions in the mouth which are affecting the body in such a way that we don't know that enough. Today it is proven, for example, that diabetes and oral health are very much related. Studies have proven that if there is high blood sugar level, it can lead to bad oral health, and if there is severe gum disease, it can also lead to poor glycemic control, especially in the elder patients. Recent studies have also proven that in oral infections and respiratory problems are also interrelated. Then also another very important thing is gum disease and heart problems. They are also interrelated. Basically what happens is when there are gum problems, there are a lot of bacteria which are present in the blood, and these bacteria travel to other parts of the body, and there they can cause inflammation and damage, especially in the areas of the heart valves. So because of this, stroke, heart attack and all such problems can occur in the elder patient. Now there are some other problems like poor denture fitting. This can happen due to lack of muscle coordination in the elders. Now there are vision problems in the elderly. Because of this, it is very difficult for them to maintain good oral hygiene, and it is difficult for them to see their signs and symptoms of oral problems like decay, gum disease, etc. Now pain in the mouth can also be caused due to besides oral problems, systemic diseases can also cause pain. For example, cardiac disease, thyroid disease, sinusitis, rheumatoid arthritis, jaw joint disorders, and many such things. So now let us talk about what are the most common oral problems. Ulcers or canker sores are the most common oral problems seen in the elder patients. Now again here there are two main causative factors or two main trigger factors, you can say. The two main factors are local factors and systemic factors. Local factors can be injury which is caused while doing some dental treatment, or irritation because of the denture, or if there is any lack of sleep, or if any tooth is troubling, if the tooth is having a sharp edge and it is cutting across the cheek or the tongue. So all these kinds of reasons are there. Systemic local reasons are there. Now systemic reasons are, there are various diseases, systemic diseases in the body like cardiac disease, diabetes, hypertension, etc. All these and many other kinds of diseases, also skin diseases, they can cause ulcerations in the mouth. Now it is quite normal to have on and off ulcers, and usually the ulcers, they do not require any specific treatment. But if the ulceration is very severe and very painful, then yes, some kind of treatment will definitely help to reduce the severity of the ulcers and help them resolve as well. So basic home remedies are to apply antiseptic and analgesic ointments, to apply homemade ghee, to do baking soda and salt water rinses. So these are the home remedies. But in case if the ulceration is still not getting solved, then the dentist will prescribe you certain medication applications, like the dentist will give you nutritional supplements, because there is chance that there is deficiency of nutritional supplements like vitamin B complex, vitamin C, zinc and folate in the elderly person. And along with that, the dentist will give local steroidal applications, gels, which will help to reduce the pain and the swelling in the ulcers. Now, the second most common problem is denture sore mouth, which is especially seen in elder patients who are wearing dentures. The one of the main reasons why this is seen is sensitivity to the contact with the denture, and it is also seen in some patients who, due to having some systemic diseases, they are taking medicines and there is a reduced saliva. So the saliva is not protecting the oral cavity, it is not lubricating it enough, and that is why when the denture is continuously coming in contact with the oral cavity, it is causing a lot of irritation. Okay, so all these things, if you are facing such kind of problem, you have to go to the dentist, and it will be, the signs for this are, there will be complete redness in that area will be seen, in the area where the denture is there. So the most important 2-3 things the dentist will advise is thoroughly washing the denture. Second thing is, if the denture is not fitting very well, then making a new denture. And if along with denture sore mouth there is candidal or oral infection is seen, or oral thrush is also seen, then in that case the dentist will advise you to apply antifungal mouthwash before inserting the denture, and also dipping the denture in at overnight in an antifungal liquid. Okay. The third and the most important point is more common lesion is oral thrush. Or oral thrush is mainly caused by Candida albicans, which is most commonly seen in some amount in the mouth, and it is not causing any harm. But if there are there are situations which reduce your immunity. For example, in cases if you are taking a lot of medications, if you are very ill, if you are consuming antibiotics, if you are undergoing cancer therapy, there are so many things which can reduce your immunity, body immunity. In these cases, what happens is the Candida, number of microorganisms, Candida albicans, their colonies start increasing in the mouth, and then the whole fungal infection can grow out of control. So initially actually there are no symptoms, but over a period of time, red and white patches or yellowish patches can be seen on the teeth. You will feel there is something cotton-like present on the teeth. So in all these, if it becomes severe, you have to see to your dentist, and the dentist will give you an antifungal mouthwash to rinse with, and oral antifungal tablets as well. So here I have completed the most common oral lesions in your mouth. If you have any queries, you can definitely ask us on 9822910294. In our next lecture, the most important one of the and interesting topics that everyone is waiting for, I am going to cover, and that is what are the most common teeth replacement options in elder patients. So I am here signing off. Thank you so much.